Hi, my name is Dr. Sydney Foster, and I'm glad to have you here today. I understand that you have something going on that you would like to address, and you think that we might be able to help you with that. Okay, great. So I'm going to go over a few things with you on what you can expect on your first visit with us. So there's three main things that we're going to have you do. So we're going to have you come in and you're going to get a physical examination.
Whoa. You look pretty physically fit there.
This is something similar to what you might have had with a medical doctor. Just the common things like checking for pulse and blood pressure and stuff like that. And then we're going to have a specialized chiropractic exam that we're going to do just to see what's going on, how your body's moving, how your spine's moving, and stuff like that. And then we will also take x-rays if needed, and we'll go from there. Does that sound good? Awesome. And then we're going to bring you back for a healthcare class after your exam, and we will have you sit through a presentation with our staff that is going to help you understand a little bit about how our office works and how we work. And then, of course, some chiropractic and health information. And then you will actually go over your x-rays individually as well as start care if you choose to do so. You will also be expected to have a form of payment ready for your care plan, whatever that may be. And we'll decide that and what's best for you after your exam. Okay? So next, I would bring the patient in for a tour. Well, for her first appointment or his first appointment, they would come in and they would get a tour of the office and then go into the exam room and the exams would be done. I would also give them information about the healthcare class, the date, time, all of that stuff, and then tell them that I will call or my staff will call to confirm that they are attending, just so they have that in the back. During our healthcare class, I'm going to go over a few things like the top reasons people seek care, healthcare in general, our philosophy here at our office, and a little bit of education about health and chiropractic in general, and then explanation of care, and that will wrap it up. So the first thing is the three main reasons that people seek healthcare are: one is to relieve symptoms or something going on with them, right? They go to the doctor because they don't feel well. They have a cold. They have, something going on, usually at a certain time of the year. And they typically are going to be treated at a medical doctor's office with some maybe antibiotics, depending on what it is. But they do usually have lab testing available, so they can receive that. But people don't just go to the doctor to go to the doctor, typically. And then another reason is that they want to be able to do things better or again. So, they haven't been able to sleep at night. That's a big one, for the last few months, and they don't know why. Or something like they used to be able to garden without back pain, and now they are not able to garden anymore. So they want to restore whatever is going on so they're able to get back to that activity. Nobody likes to be restrained. We're human beings. We like to interact. We like to do things. And so being able to do things better or again, that's what they want to do. The third thing is people just want to continue possibly just living their best lives that they can, to their full potential. They might not have any complaints, but they don't want anything to cause future things to happen where they are unable to do what they are doing currently, or even more than that, like compete in a race or, play college football and or things like that. So those are the three main reasons that people seek healthcare. So as a healthcare provider and a chiropractor, I do have a philosophy where I just want to help patients live and grow and thrive, um, so their bodies can carry out what they're supposed to do to their best of their abilities. That means I am only helping things function or work like they should. My hands, these hands, they're not healing you, okay? Your body is healing you. We have an amazing network inside of us that is able to communicate with each other, so we are allowed to live, first of all, and do things we never thought possible. This is called the nervous system, and a lot of people are really familiar with maybe the heart or the lungs or, major organs in the body, but I feel like they might forget about the nervous system. We have certain communications that go to each part of our body so they can do what they need to do. And I am just here to make sure nothing is blocking those signals so they can't get to where they need to go. Okay? It's very complex, but it can also be understood very simple. So the last thing that we'll go over is just the explanation of care plans. What's a care plan? Is it a contract? Those types of things. So let's kind of jump back to where we were at the very beginning, where I talked about three main reasons that people sought out healthcare, right? To relieve symptoms or something going on with them, to get back to what they want to be doing again or be better at what they're doing. And the last one, or just to live to their best ability, right? So all of those entail diversity. Everybody has different bodies. Everybody has different goals with their lives, right? So that is why chiropractic is so exciting, because we have specific adjustments and tables and techniques that are used for specific people and what their body needs. A 72-year-old woman might want to be gardening again, and she is going to use some specific different adjustments than a 21-year-old football player, for that matter. What's really neat about it, though, is, like I said about the nervous system, it's all the same inside of us. So it comes back full circle. So we're able to consistently help people in the way that we are trained to do. So a care plan is going to be different for each individual. And you also will have options to choose what's best for you and what you feel most comfortable with. It's nice to have you back with us today. So I'm just going to go over and talk with you a little bit about your exam and your x-rays. We showed you the phases of degeneration, which we showed you which one you're in. And we definitely want to take care of that. You said that you are experiencing headaches and low back pain, and that you sit a lot for work. So we definitely want to make sure everything is moving the way it should. With that being said, we also saw that your head was a little bit forward instead of back where it should be. And then you had some straightening of your neck bones instead of in that nice curve like we showed you. So that could explain some reasons for your headaches. And then for your low back pain, sitting all day definitely flattens out with those discs we showed you. It kind of squishes them. And we also noticed that they were just not in the right spot. Okay, so due to all of that, we would love to start you on corrective care. It's best to start that for at least 4 weeks, for coming in 2 times a week, and then we'll reevaluate everything after that. It's not a contract, it's just saying that you'll start care, and then for that we have an option of $250 a month. And that's for unlimited adjustments though, so if you need to come in more than that, you most definitely can. And then this also doesn't put you at a limit for your adjustments. If you miss one during the week, it's okay to make them up. Does this sound like something that you are ready for? Okay, awesome. So we are gonna go ahead and get you all signed up, and we will start your adjustment.
What kind of stuff? Oh, okay. That's awesome.